Welcome to the Bergeron Forum, everybody. And just a couple of announcements. This afternoon in Nevins at 4 o'clock, there is an event put on by Ukrainian students who are here. Alfred, Desmond, I've already forgotten the title of the event. Ukraine as it is. Thank you. That's at 4 o'clock today. That should be very interesting. And next week's Bergeron Forum will be given by Amanda Taylor-Lipnicki, Math, Art and Culture in Finland and Iceland. Very eclectic and very interesting. Today is unique in the storied annals of Bergeron Forum presentations, because this is the first time ever in over 50 years that we have non-human animals on stage. And so I'd like to introduce Susan Morehouse, Professor of English, Lynn O'Connell, Professor of School Psychology, Jam, a corgi, Blue, a lab, right? Part lab, sorry.
He's a labradoodle, which isn't a real
Labradoodle.
breed.
And Rob Price, their lovely assistant. So they are going to talk about therapy dogs on college campuses.
Thanks, Em.
Thanks, Emrys. Thanks a bunch for being here.
Being a good boy.
Sit. These are both working dogs. We're going to talk a lot. We have a lot to sort of jump through and share with you. We had a hard time condensing everything we collectively know about this topic into a 30-minute talk. If you can hold your questions, I think we'll answer a lot of them as we go through, but at the end, we will save time for some of the questions that maybe we didn't address. So we actually think we're the support folks for Jam and Blue because they are the real stars here. They're the ones doing the work. These are our fun faculty pictures. Who wouldn't want a picture with your dog, right? It's much less stressful. So let's get oriented a little bit to what we hope to accomplish with you today. We're going to talk a little bit about dogs as human helpers. Been around for eons. Therapy dogs, Jam and Blue, you're going to learn a little bit about each of them and their characteristics and what activities they do. One of the areas of confusion in the world today is the differences between service dogs, therapy dogs, and emotional support dogs. They're very different. There's very clear guidelines, legislation, rules of what they can each do. So we hope to answer some of that and untangle some of that confusion. Talk a little bit about what both of these guys had to do to get through therapy dog training and what sort of skills they have and what sort of skills we have to be able to be handlers of therapy dogs. Rob's going to do a little bit of a demo with Blue on how to approach a dog safely in the community on campus. And then we're going to talk a little bit about therapy dogs on a university campus. So, Susan, you want to start?
Oh, when we're talking about animal-assisted activities?
Mm-hmm.
Sure. So it's not just dogs, first of all. When we're talking about emotional support animals or service animals or therapy animals, although dogs are the most commonly used animals for these different kinds of support. And as you can see on this, we have some of the terms. Service dogs are, for instance, the first service dogs were the guiding eyes for the blind dogs. And we know that there are several people on the campus over time who have been training those puppies. Service animals, those service dogs have training that lasts, upwards of 3 years. And even after all the training, they may not pass the tests that would enable them to be an individual's eyes, in a sense. Emotional support dogs and animals, on the other hand, don't necessarily have any training whatsoever. I've had somebody ask me before, isn't just having Jam here and calling him a therapy animal, doesn't that just mean you're sneaking in your emotional support animal? No, it doesn't. But yeah, do I like having him around? I sure do. But there's no training necessarily for emotional support dogs and animals. There was a peacock on a plane, was there not?
Yes, there was.
Yeah, a while ago.
In
I'm
the
not quite
news.
sure what emotional support that animal provided, but and then therapy dogs and animals. I've seen cats in therapy positions as well, but with the dogs, they go through a series of training. What they are is extraordinarily obedient, and they work well with their handlers to perform particular tasks that let them work in social and public settings like this one today. I know that, for instance, search and rescue dogs are also work with a specific handler, as our dogs do. There was a professor at Dartmouth who had a search and rescue dog for people wandering off into the White Forest. That was on campus there. And then, of course, we know a little bit about the military and police canine dogs who perform a number of services.
Yeah, so there's a lot of different roles that the dogs, and the dogs are the number one service or therapy animal or species of animal. And there's a lot that, there's a big reason for that, and that's the human-animal bond. The dogs have a unique relationship. They have very similar social structure as human beings. They have an alpha leader. They have followers. They take care of their young. And so the dogs have been bred for centuries to help humans in a variety of different ways. The human-animal bond is a universal phenomenon, regardless of culture, country of origin. And the field of animal-assisted therapy, or AAT, is relatively new. You wouldn't think it, but it's really only been the last 30 years or so that dogs or any animal have really been used in a active therapeutic approach. They've been in institutions for a number of years, about 100 years or so.
Yeah, wasn't it Florence Nightingale who first noticed?
Yeah, absolutely.
That dogs were really helpful to patients when they were recovering from trauma.
Right. So we have a lot of different professional disciplines, medical disciplines, physical therapy, occupational therapy, nursing, that have found the benefits of using dogs particularly to help people. So just a quick review, dogs have been around herding for homesteaders.
This is a herding dog.
That is a herding dog.
I know.
He's got little legs, but he's pretty fast.
He was also a stud. So our vocabularies can broaden here.
Right. Guard dogs, certainly hunting and fishing dogs, retrieving. Blue is actually, his background and his breeding history is to be a helper to a fisherman and go out and reach. So he's very interested in ducks and birds. Companions, once we shifted from having our dogs be helpers for survival, they then became family members and they became our buddies and our companions. And so Rob asked, is Blue more therapy dog than pet? Well, he's pet. Like, how do you not love a dog that lives with you and sleeps on your bed and not call him, part of your family? But he has to work to earn his keep.
His biscuits.
Yes. Here, Florence Nightingale, she started kind of this idea in the medicine world that she was asked to take care of a sheepdog who was badly injured. And that's kind of what prompted her to go into the nursing field. So it's, that was 1800s that people were realizing that dogs could have a benefit for the human being. In therapy, mental health therapy, the first person to really use a dog to help children was Boris Levinson. He was a child psychologist. He just happened to bring his pet dog to the office when he was working with kids, and he figured out that, those quiet, withdrawn kids actually talk more when their dog is in session and participate more and are more engaged. And he's like, I'm onto something. It created better therapy. More things were resolved for the child. So let's meet Jam. Susan, can you tell us a little bit about Jam? What's his age, breed, temperament?
Right now, Jam is in what we call a full
Sit.
splute. With
Down.
his little drumsticks sticking out behind him. The good sign there is that he's actually very relaxed right now, which is good. He is a Pembroke Welsh Corgi, so a little bit more about relaxed. A lot of people meet Jam. He's really a terrific professor. But he's not a typical Corgi. I would not call the Corgi breed as a whole chill. That's not their thing. They, Border Collies are herding dogs too, and they do the I see you and your prey thing. These guys rush in nipping and barking, right? They're tough. But when I adopted him, he was 3. He was a breeder stud. I wasn't making that up. I noticed that he was really a mellow dog. And so I thought, I've done obedience work in rallies with him, but I thought about him as a therapy dog. And so the first step is I started working with a group of 4-H kids who were training their dogs. And those children are amazing, just the work that they're doing with their animals. I loved working with them. I wasn't training them. I was them. I was like a 4-H kid, only bigger. We trained for and passed our AKC Good Citizen exam, which is an obedience exam, and our AKC Advanced Good Citizen exam. And then we did the training that would allow us to pass our therapy dog exam. And we can show you in a minute some of what we had to do to pass those exams. He has worked at the AU campus, which means that Pet Connections, the organization that I work with, has been here and evaluated us working as a handler in a dog team on this campus. We've also worked at an eating disorder clinic. We were the relaxation before dinner, because as you can imagine, dinner is stressful for many individuals. And so we would come in there. We worked in reading programs at libraries and schools for children. So he does animal assisted education. We've also gone to various ARC clinics in Western New York as well, and visited people who are there.
Thank you. So Blue. Blue is going to be 7 next week. He is a mixed breed dog. He was marketed as a Labradoodle. Labradoodle is an AKC approved breed. One parent was full black, registered black lab. Another parent was a full standard poodle. He doesn't have the curly hair, but he doesn't have a traditional dog undercoat. So he was marketed as being hyperallergenic. A young family got him with children who had allergies to dogs for a Christmas present when he was about 3 months old. And guess what? He's not that hypoallergenic. And so they had allergies. And that's sort of how I got him. I thought, who can turn down a black little puppy that looks so cute and is bouncy and excited and gives lots of kisses? Blue's temperament is very affectionate. He thinks he's a little dog, but he's in a big body. He likes to sit on your lap. He likes to give kisses. He likes to snuggle. He loves to play ball and swim, because retrievers and poodles were bred to retrieve the ducks or the birds that were shot from hunters. And so did they go out and swim in the lake and bring it back. So he can swim for days. If you don't know where he is, he's probably in the water. He still has a pool, those kiddie pools that are up full of water, even though it's almost November, because when he's done chasing balls, he has to go lay in the pool and cool off. Blue's certified under, or we're as a team certified under the Alliance of Therapy Dogs. So Jam is under Pet Connections. There are multiple organizations that certify therapy dogs. All of them require training and coursework. observations by the evaluator actually doing the therapy in facilities, and then ongoing training and practice and visits and keeping up with your skill set like any other skill, whether it's the dog skill or the handler skill in managing the dog. You have to keep practicing or you get rusty. So similar to JAM, Blue started with the American Kennel Club's Canine Good Citizens test. That's usually a standard. It's basic obedience. They also have a puppy socialization class that starts when they're about 6 months. The Canine Good Citizens test, you can train your dog starting at a year. And then usually you do a therapy dog training through one of these organizations. And that could be, usually it starts around 2 years of age for the dog. And it's more advanced types of skills because these dogs are going into facilities where there's vulnerable people, young children, elderly people, sick people in hospitals. And so they have to be super obedient and under control of the handler and not, too exuberant or excited.
They also have to be obedient and responsive to the handler because there may be, one of the handler's jobs is to assess the situation that you're in and to make sure that it's safe for the dog. So if, for instance, you were in a hospital and there was medication that had been dropped on the floor or a hypodermic needle or something, you, first of all, are responsible for paying attention to it, but you have to be able to stop your dog from picking that up.
Here's an example of that. I've put a treat that he absolutely loves on the ground, told him to leave it, and he's listening to me, not taking his eyes off the treat until I give the command. Okay.
Wait, nope.
And so if he drops, if I drop my medicine in the morning, that he needs to not just take whatever thing thinking it's a snack or a piece of toast.
Okay.
Blue is works. Blue has a couple of different jobs. Sit. Down. Down. One of the things as a dog handler that you have to be able to do is you have to be able to manage the dog while doing other things. A lot of multitasking going on. My first responsibility is making sure that he's under control and doing what he said. Like a child, if you give him an inch, he'll take a mile. And so he'll kind of test the limits. Whoops. I did want to talk about where Blue's worked. Blue is certified with 2 handlers. So my husband is a school psychologist. He's also certified with Blue. So we both had to do the testing. We both had to do the observations by the evaluator. He's in a local school district. So Blue goes every Friday and some other days, does a lot of work with kids that are having, especially young children that are having meltdowns, temper tantrums, behavioral, just turning to mush on the ground. Blue will walk in and things just stop. The light switch will turn off and kids are calm again. One of the stories my husband likes to tell is there was a child with autism in a classroom who was crying because she didn't like the feel of her clothes and she wanted to take them off. And obviously you can't do that at school. And so they brought Blue in and she's like, "Oh, Blue." And she stopped crying. The clothes no longer were a problem. She went back to doing her classwork. 20 minutes went by. Mike left with the dog. Temper tantrum came back, but at the moment, she had gained control. And so there's something important about the dogs. He also does a lot of greeting and just fun stuff. It makes the climate at school nice. Blue works here. There's some pictures here of my grad students in the school psychology program at the Child and Family Services Center, where we do mental health treatment for children and families. And if the situation and the client is right, and the child or family can benefit from Blue working with them, then we'll bring him in. I also have a private practice in Wellsville where I do psychological therapy, and he works there almost every Wednesday with me. I was sharing with Rob that he's worked with kids with selective mutism who are hesitant to talk. And he's worked with kids from trauma who were attacked by a dog, helping both of them overcome those fearful experiences and be able to function more completely. So what are the differences between service therapy and emotional support animals? Pretty big differences, often confusing. Do you want to run through these?
Sure. So the service dog is a dog that's specifically trained to perform tasks for one individual. And without those services offered by the dog, that individual can't live a full life. And so the service dog, and I don't know if we have another slide about this, but the service dog, when you go to Wegmans and you see no dogs allowed except for service animals, they're talking about that dog or miniature pony, though I haven't seen one in Wegmans yet.
Not yet.
That is enabling that one individual to live a full human life. So they are protected and allowed to go places under the Americans with Disabilities Act, which was passed in 1990. I think that's pretty good.
Yeah.
Yeah. So the therapy dog is trained to bring comfort and joy. Oh, I feel like a Christmas song coming on here, to those in hospitals, schools, or other group or care environments. And they do a range of things. Therapy dogs can be, as Jam is, a dog that assists with education. So he has to be able to, for instance, settle comfortably next to a child who's sitting on the floor with a book. You know, he was tested for that. Can he settle within 2 minutes? He settles pretty fast, actually, so that a child can read a book, because studies have shown that children reading to dogs, it turns out, are much less critical than English teachers about, you know, things like pronunciation and everything. And so the dog really facilitates the process of learning to read and pleasure in that activity. So that's animal assisted education. He also does animal assisted interventions, which is, for instance, coming into my classroom and making everyone happy that they're taking their midterm exam. Or just being on campus and being somebody who's happy to see you. That would also be what he was doing in the eating disorder clinic as well. And what Lynn is talking about with her therapy dog is a dog that's actually a partner in therapy work with her to assist the children mostly that you're working with. Therapy dogs, though, are classified as pets. These dogs are here because they were invited to be here, not because they're allowed to go anywhere. And a lot of people aren't clear about that. And they say, well, you've got a therapy dog, you can go anywhere. I can't, no. He wouldn't like Wegmans anyway. Emotional support dogs are also a pet. That's their legal category. That they provide emotional support and comfort to one person. These dogs work in public settings and provide support for multiple people. And these dogs are also have pet status. They cannot technically go into Wegmans, but they are supported under the Fair Housing Act, which means that you cannot, if you have an emotional support animal that a doctor has said, yes, this person needs this animal in order to function in their life because of certain emotional needs, right? Then a landlord, for instance, cannot say that this is a dog-free apartment, I'm not renting it to you because that animal and your relationship with that animal is protected under the Fair Housing Act. So that is the one legal thing that's different.
Yeah. I'm going to jump back. I just moved through these slides real quickly.
Sorry.
That's okay. No, you did great. So I just have a couple of more. There are 7 types of service dogs. These are the dogs that belong to one person with a disability that are trained as an accommodation to sort of level the playing field, help the person with the area, whether it's mobility or hearing. etc. There's also psychiatric service dogs, veterans particularly who have PTSD. These dogs can go into an apartment, turn the lights on, screen the space for safety, make sure there's nobody there. And so all of these dogs are particular types of service dogs. These are the dogs that can go with the person with a disability in any setting, according to the Americans with Disabilities Act. There are a few rules around service dogs that are always important to know. When you're not sure what somebody says, okay, this is a service dog, and you're not sure what the service, what it's not apparent what the animal is trained to do, there are only two questions you can ask. Is one, is the animal required because of a disability? Remember, a service animal is either a dog or a miniature horse. There's not that many miniature horses out there, mostly are dogs. But is the dog required because of a disability? And then what work or task has the dog been trained to perform for you? What you can't ask is, what is your disability of the handler? Can you show me what the dog can do for you? Can you provide medical documentation that you need the dog? Or do you have a special ID card or training documentation? You cannot ask any of those questions because remember, this is for a person with a disability. And so that information is protected health information.
Can I add to that for a minute?
Sure.
Here's something that it would be good if people didn't do. A lot of people want their animals to be with them, no matter what the circumstances are. And so, of course, you can go online and Google and buy anything. And people do buy therapy designations and say that a dog is, or service designations, and say a dog is a service dog. When they take a dog into a situation claiming that it is a service dog, and remember, you're talking about an animal that has had at least 3 years of really specific training, if it is a service dog, then that animal has been put in a situation in which the animal itself isn't safe because the animal's confused, because the animal doesn't know, because it hasn't been trained what it's supposed to do. So when a person makes that kind of decision, it is unfair to the animal first, probably to all the people around it, because the animal, again, does not know how to behave in the settings in which it has been placed. But it causes problems for people who actually do need service animals to assist them. So I just wanted to add that because it's a serious issue.
Yeah, it's an important point. And that's why it's important you understand the different terms and how what they're allowed to do. Susan talked a little bit about therapy dogs, two different kinds. Those that have volunteer work, like Susan does with her pup Jam, and then people like myself, mental health, physical therapists, occupational therapists, speech therapists, medical situations where the therapy dogs help in goal-directed treatment for a person. What makes a good therapy dog? How old must a therapy dog be?
Well, you just said that 2 is a good age.
Two
I've
is a
seen
good age.
people doing the training with younger dogs, but a lot of them just don't have focus.
Think about, a toddler who's 2 or 3, they're not really ready to have self-control and be able to turn on control on and off.
He was 3 when I adopted him, so he was in full possession of his faculties at that point.
What breeds make good therapy dogs?
That's a really interesting question. You would think that a golden retriever, my other dog, would be a great therapy dog. Juliana's going. It's true that she does love everyone, but focus, not her strength. Any dog can be a therapy dog. What they have to have is the right personality. It's like the rest of us. Any of us technically could do anything, but we're probably better suited for one thing rather than another. My first corgi would have been much better suited to be an agility animal, right? He was never going to settle down, right? But he's relaxed.
Yeah. And the temperament piece or personality of the dogs really, they have to be curious. They have to be really interested in human beings, probably more so than other dogs. They want to be on your lap. They want to give you affection.
They're actually comfortable here right now, which could be a very stressful situation for another animal.
Or a human.
Not stressful at all.
Therapy dogs are not service or assistance animals. We've talked about that. These are just pictures of different types of animals, bunnies, horses, dogs. Just giving therapy, making people feel good.
One thing that we have talked about before is, for instance, when I've gone to clinics where people are in wheelchairs, he's super nice, but he's of hard size. If you're sitting down, you still can't reach his head to pat him. And I have to sit in a chair holding him for somebody to meet him. So Blue is a better size for those kinds of visits than he is.
Yeah.
One other thing is they have to be clean when they go. He sheds. So he has a lot of baths.
And that's part of the organization. When you become certified under an organization, there's rules about you need to give your dog a bath before each visit. They've got to have vet checks. They've got to be clean from worms. There's a lot of things that, there's a lot of work that goes into having a therapy dog. It's not just a pet. Blue loves to watch TV, by the way, so he's particularly interested in this big guy here.
And Jam's deprived. We don't have a TV. Terrible.
Interesting, as of 2020, ESAs are no longer allowed on airplanes, probably because of the peacock incident in which the woman wanted to bring her pet peacock as an ESA, and that just isn't going to work on an airplane. So where can you take them? Susan mentioned this idea of therapy animals just being somebody's ESA. I thought this chart, Susan thought this chart too, made a good explanation. So the primary, who are we helping? Therapy animals help many people. These guys, not so much. Primary roles to support one individual. Assistance animals and ESAs, yes. Therapy animals, no. Okay, to approach and pet in public place. I get a lot of questions on campus. Oh, he's working. I'm not supposed to say hello to him. Actually, that's the exact opposite. His jacket says a therapy dogs. Therapy dogs are here to help us feel better. Anybody can approach him and pat him and engage with him. The dogs you don't want to engage with, you don't want to make eye contact with, acknowledge, pet, talk to,
Are the service dogs.
are your service dogs. Or
But
assistance
it's always
dogs.
good when somebody asks us, may I pat your dog? May I interact with your dog? I know when I have him just out in the neighborhood, that's something that we stop and teach children who just kind of come running up to him. And in fact, this might be a good place to do
Show?
Yes, why don't we show how to approach a dog? Come here. You come here, because Blue's going to work with your
How to
dad.
greet a dog?
Yeah.
So there's a set of skills that you need up when you're approaching. So Blue, come with me. Okay, so Rob and I are going to walk up. Rob's going to stop and stand in front of Blue about 2 feet away. He's going to ask if I can pet your dog. He's going to turn his body, invite the dog into his space by holding out his hand and see what Blue does. He's going to scratch him if Blue looks like tail wagging, and it looks like he's interested. And then just for a few seconds, and then back away and try again. So you don't want to get in the dog's bubble. Okay, ready? Blue, heel.
Nice looking dog.
Thank you.
Say
Well,
hello.
just a sec. There you go. Okay. So Blue's entering into Rob's space. Rob can bend down now and scratch his ears. Under his chin is preferred, even on his side or his hip.
But not the hand coming over on top of the head. It's like
Rob
big hand
wouldn't
coming
like
down.
it if I
Not
pet
a-
his head
not a
like
good
this.
idea.
Blue doesn't like this unless he's very comfortable with somebody, right? And
We
then
were comparing it before this started to kind of good cocktail party manners when you're meeting somebody. You don't crowd into their space. You don't
This way.
start touching them.
Thank you.
And after an opening conversational gambit, it's kind of nice to back up and see if that person actually wants to talk to you. Sort of like that.
A little bit about therapy dogs on campus. They've become much, much more common. More campuses than not have therapy dog teams working. Counseling centers, exam week, orientation week, out on the lawn or in the office. They relieve stress, loneliness, homesickness, anxiety. They increase well-being, calmness, emotional sense of belonging to a community. There's somebody that knows them, provide comfort, decrease. There's a lot of physiological research that decrease the stress hormones, increase the pleasure hormones. Who wouldn't want that, right?
But those studies are relatively new. Originally, it was pretty much a bless your little heart. Be sure you can bring your dog. Most volunteer therapy dog handlers are middle-aged women. Most of the dogs, more of the dogs are male than female, I believe. So there really was a kind of, well, if you want to, it's okay. But now there's research that shows those things that Lynn was talking about, that it really does make a difference to people's happiness and well-being. It's a real thing.
It's a real thing. In fact, I didn't put the slide up there, but there is a cardiologist who studied people who had massive heart attacks and whether they had pets at home. And the people that had pets at home, this was about 1980s. The people that had the dogs at home had greater recovery, quicker recovery, longer lasting recovery. So the dogs help with our cardiac, help with our general physical well-being, as well as our emotional.
We're getting close to time, so if we can pull it
Sure.
together and leave room for questions.
Yeah, so I just want you to know what to do if you walk up to a dog on campus, because there's lots of dogs. There's the Guiding Eye Dog Club, there's these guys, there's ESAs around. You ask the handler, what kind of dog is this? Can I pet your dog? Should I pet your dog? Is your dog a therapy dog? Yes, that means you can pat and approach. If it's a service dog, you just have to keep walking and not engage with them.
And our job is advocating for the dogs, making sure that the situation is safe for the dog and for any of you. So I have occasionally had to say, please don't put your face near the teeth end, because dogs are dogs. They're wonderful. They're fabulous in these circumstances, but they're also
Real live animals that react and might be having a bad day or might be curious. So you always have to the handler always has to be able to manage them. What sort of questions? Let me get to the end here.
Do you have for Jam
I'm
and
going the
Glow?
wrong way. What sort of questions do you have for Susan and I, or Blue and Jam?
Can I say, first of all, thank you for the presentation.
Sure.
Also, people have questions. If they use this microphone for the benefit of the people listening on Zoom.
Hi, Danny.
Danny doesn't really need a microphone, but
Hello, thank you so much.
Sure.
Is it possible for faculty members to rent your therapy dog? I teach a course on death and dying, and the last time I taught this course, we actually had a service dog in the class accidentally, and it was amazing. So is it possible, in psychology, or if we know we're having a difficult class or difficult discussion, we might be able to invite the dog to come assist with class?
I can answer that in some ways. So it's not a mistake that we're a team. These dogs actually come with the handler that is certified to come with them. So if you have a dog, for instance, in a school setting that is helping a child, like the child with autism that you were describing, who might actually be there like for the whole school day. That means there's a handler there at the same time. So certainly if we were free as a team, absolutely. But the handlers, we're well trained too.
We hope.
Yes. So that's a really important part of it. We don't just say, "Bye, Jen, have a good day at work. It's okay." I can't do that.
No. So yes, we can come as a team to help a particular class, but you can't just take the dog and bring him with you.
Good.
More questions?
That's a good question.
Thank you. Sorry.
Yep, we can hear you.
Yeah. So for humans, we have a very large prefrontal cortex and all of such because we are more social animals. I was also wondering, like, if dogs have any part of the brain that's more like developed.
Yeah, absolutely. Their prefrontal cortex, not as much as humans, right? But that's why their dog as service dogs, therapy dogs, they're smart, they're trainable, they're unconditional positive regard, that they love you no matter if you've had a bad day or you have bad breath or whatever, right? So they accept us, and that's what makes us feel good as a human being. And they're the most trainable animal other than, I know people love their cats. I have too, but they're just not trainable in the same way that a dog is.
Thank you for corroborating that. I would also, can I just add something? But one of our jobs as handlers is also knowing they're not only loving and stable and have, but they also feel things deeply. So sometimes when I've had him in a clinical situation that's a little bit fraught, or somebody's loving on him who's communicating through that loving a lot of anxiety, it's my job to know also when he's had enough, because he's taking it up.
Yeah, they're like sponges, right? And so Blue in the therapy clinic has a crate, and there's times if he's with a client who's been crying and sobbing for 50 minutes over, a separation with their partner, he's taking that in. He needs to go debrief and chill out in his crate where he can just be himself.
Yeah.
When he has this on, he knows that he's supposed to be working and attentive, but he also needs time to be a dog. I want to go back to Danny's question though. The only exception, because my brain was going, is if you trained as a handler and you passed the certification test with him, then you would be able to have him work with you.
More questions? There's one question from the chat, I believe, at least one.
Good boy.
Gary Ostrauer is asking, how extensive is cheating in the sense of calling animals therapy dogs when in fact they are not therapy dogs? Likewise with service dogs.
The kind of cheating that I was talking about.
It's pretty prevalent, actually. So service dogs usually are trained from a service organization that trains service dogs, right? Mobility service dogs. And so there's less cheating, if you will, with that. Therapy dogs, you can buy this, right? And put it on your dog and not have gone through any coursework or training. But it's going to be noticed, right? You're not going to have a good command. But when you go to a school or a hospital, they will ask you for your documentation, your rabies documentations, your dog license, your therapy dog certification number. Emotional support animals are a little more tricky. Those folks have the emotional support animal. Let me back up. The person with the disability, the mental health disability, has to be evaluated by a mental health provider, psychiatrist or psychologist, has to recommend that the person needs an emotional support animal. And the emotional support animal is really for housing only, not to go to class, not to go to the pharmacy, not to go to the park, therefore living a life in a place where they can find comfort and support. And so there is more confusion around that topic or type of animal than the other two, therapy and service. Yep.
Any other questions? We're pretty much out of time, but if you do have more questions, please come to the front and meet the Blue and Jam and Rob.
Yeah, and you're
as well.
welcome to, if you just want to come say hi. These are therapy
And-
animals. They like to be
You
pet.
can say hi to these guys.
And one last thing, don't forget to pick up your copy of the courses in human studies for next spring outside. They are free, but they are in very limited editions, so they're kind of precious. Thank you.